nurse for today. So could you verify your name, please? Verify your name and date of birth. Okay. We'll take provide privacy. Okay. Do you have any allergies that you know of? No. Okay. So today I'm gonna be getting your vital signs and doing a skin, hair, and nails assessment, as well as head to neck assessment on you. So I'm gonna assess your level of consciousness. So could you tell me your name once again? Do you know where you're at right now? Do you know what time it is? Do you know the reason why you're here today? Okay, good. So your speech is clear. The way you're talking is appropriate for your age. Overall, nice appearance. You look very well put together. Your posture is great, and your overall build looks good as well. So before I start getting your vital signs, I will be asking you some questions. So, do you have any history of rashes or skin problems? Okay. Do you notice any changes to your skin, hair, and nails? Any current itching, rashes, scars, bruises, lesions, all sort of those skin things, skin problems. Okay. Any family history of skin cancer? Okay. Do you often get headaches, or do you have any head or neck injury? Any problems with vision? Do you wear contacts, lenses, or glasses? Any problems with hearing? Use of any hearing aids or hearing devices? Okay, good. Oh, sorry, excuse me. Okay. Any problems with your nasal? Do you have any nasal congestion, drainage, trauma, or surgery? Okay. And any problems with your gums, teeth, or throat? Okay. Do you have any lumps or swelling in the neck area? Okay. Good. Those are all the questions. So now I'll be getting your vital signs. So first I'll get your temperature. I will take the thermometer, place the probe. Would you open your mouth for me? And I'll place it under the tongue, side of the mouth. Have you close your mouth tight. Breathe through your nose. Okay. And take it out. And I will tell you your temperature in Celsius and Fahrenheit. Make sure those are within normal range. Clean the thermometer. Place it back. Okay. Now I'll be getting your pulse and respiratory. I'm getting your pulse. So let me check your radial pulse. And then I'll count your pulse for 30 seconds and multiply it by 2. While continuing that, I'll simultaneously look at your respirations. One inhalation and one exhalation equals one respiration. So and I will be counting that for 30 seconds, multiply by 2. Make sure both the pulse and respirations are in normal range. And I would know any abnormal findings. And so I'll be getting your pulse off. Stringent, saturation, doesn't matter which finger I use. Okay, make sure it's in normal range. I'll clean it. And then I'll be getting your body pressure. Let's go. Make sure I grab the appropriate cup size for the arm. Wrap it around. Okay. Helping for the feel pulse. Pump it up until I can't feel the pulse. Okay. Squeeze out air back, let it rest for 1 minute. Okay. Then I'll measure your actual full blood pressure. I should pump it up to 30 more than the number that I took. Now I know the systolic and diastolic numbers. Okay, make sure both of those numbers are within range. I'll clean it and note any abnormal findings. And hygiene. Okay. Are you in any pain right now? Okay, if you are, I would kind of know where the pain is located, how severe it is, the duration, any episodes of the pain, what happened earlier, any tests or any treatment that helped with the pain. And then I would note those subjective data. Okay, now we'll be doing the assessment. I'm going to start off by assessing your hair. I'm going to inspect your hair for the quantity and distribution. Hair looks distributed evenly all throughout. I'm going to check your hair for its overall condition. Seems like looks like your hair is clean, looks good. And I see no presence of lice or nits, so there's no infestation. And there's the hair color is appropriate for your ethnicity, and there's no funky odor coming from it. I'm gonna palpate your hair for texture. Your hair texture is smooth, which is good. I'm gonna inspect the size and shape of your skull and the position of it. The contour, your skull looks good, head is all round and looks full. Then I'm gonna check the position and alignment of your facial structures. It looks very evenly distributed throughout on your face, looks good. So I'm gonna ask you to do some few facial expressions. Could you smile for me? Okay, raise your eyebrows and puff your cheeks. Okay, doing that to check for cranial nerves 5 and 7. And then I'm gonna inspect for any involuntary movements. Now I'm gonna palpate your skull for any nodules or masses. Which I don't feel anything, which is good. I'm gonna check the position and alignment of your eyes, eyelids, eyelashes, and eyebrows. All looks very in good alignment, very parallel with each other, equal length. And I'm gonna check for hair distribution on your eyelashes and eyebrows. Which looks good. I'm gonna palpate around your eyes, eyelids, and the lacrimal gland. And see if there's any masses or lumps, which I don't feel anything. And I'm gonna check for the color and condition of your lens, conjunctiva, and sclera. I don't see any abnormal things about it. It looks very clear. Looks good. Now I'm gonna assess for your pupils. I'm gonna check your pupils for its size, shape, and symmetry. So I'm gonna close the light in 3, 2, 1. Okay, your pupil size and shape are very equal. I'm gonna turn the lights back on in 1, 2, 3. Your pupils looks equal. The size looks good. It's very symmetrical. Now I'm gonna check for pupillary reaction. So if you could just look straight across for me. Okay. Okay, and your pupils, both of your pupils should be equal, round, reacting to light, and have good accommodation. which is good. Now I'm gonna have you look at my finger and you're going to follow my finger wherever it goes. And I'm checking for your cardinal fields of gaze. So, okay, looks good. So I'm gonna check your ears for its position, alignment, size and shape. Looks good. I'm gonna check the color condition and notice if there's any drainage of both of your ears, which I don't think. Then I'm gonna palpate around your ear in the mastoid area. And then I'm gonna assess for hearing throughout while I'm doing this. So overall, you hear me pretty well when I ask you to do those facial expressions, which is good. Now for nose, I'm gonna check your nose for its size, shape, colors, and integrity. Now I'm gonna check the nasal mucosa, so inside of your nose, for its color, integrity, and any drainage. Doesn't seem like it, which is good. Thank you. Hand hygiene. And could you lift your nose up for me so I can check for any obstruction? Okay, it doesn't seem like it. That's good. Now I'm gonna palpate your frontal and maxillary sinuses. Okay, looks good. Okay. Now I'm gonna check your lips for the color, texture, and moisture. Your lips look full. The color is very pink, which is good. Not your lips are not too pale, and you don't have chap, and it's not chapped, which is good. Now, could you open your mouth for me? I'm gonna check your teeth and gums. Looks like they're in a very good condition, which is good. Now, I'm gonna check the inside of your mouth. I'm gonna check for your tongue, your lower palate, and mucosa of your mouth. Looks good. Okay. I'm gonna also check your tonsils for size, shape, color, texture, and notice of any drainage, which I don't see. Good. Okay. Could you stick out your tongue for me? Okay. Could you lift your tongue up? Okay. Good tongue movement. And then could you swallow for me? Okay. Looks good. Now I'm going to inspect the color and skin integrity of your neck. It should be the same color throughout your whole face as well. And I'm gonna check the position of your trachea. Okay, looks good. And check your neck mobility. So could you look to the left? Okay, now look to the right. Look up. Look down. Good. Okay, so I'm gonna place my hand against your cheek and you're going to try and push my hand away. Good. And then on the other side. Okay, good muscle strength on your neck, and there is good mobility right there, which is good. Gonna palpate your neck for tenderness. Your neck should not be tender, it should be firm. Any tenderness, the swelling. No, this isn't. Now I'm gonna palpate for the lymph nodes. So I'm gonna start from the back, so back side of your face. I roll my way behind the ears, go back down, all the way up to my spine, all the way here, go back down, go all the way around to your chin, down to the side of your neck, and then out into the collarbone areas, your collarbone areas, which is good. Okay, I don't notice any abnormalities of the lymph nodes, which is good. Now I'm going to be assessing your skin. I'm going to check for your skin color. Uniformity and symmetry. Your skin is evenly distributed all across. The skin color is appropriate for your ethnicity, which is good. Sitting. I'm gonna check for skin integrity, notice any lesions. If there are, I will nail it down. I'm gonna check for trigger immobility. And grab the skin from your collarbone, and your skin should immediately go back, which is good. I'm gonna check your skin palpate for your skin texture and moisture. Skin texture is smooth and it is dry, not too moist, which is good. I'm gonna check for your skin temperature. If you can put out your arms like this, it should be warm in both arms. If you can lift up your shirt so I can assess check your temperature on your stomach, if that's all right with you. Okay, now on your legs as well. Okay, then I'm gonna check for edema. And then could you lift your shirt on the back, if you're okay with it? Okay, and then I'm gonna check the back of your lower legs as well for edema, which I don't feel anything, it looks good. Okay, now I'll be checking your nails. So we can pull it out like this. Okay, your nails shape looks evenly rounded throughout. Contour looks good. The pigmentation looks good, pale pink, which is normal. Notice the condition of your nails, it's just very clean. You take very good care of your nails, which is good. Could you put your nails out like this? Check for any clubbing. No, I don't notice any clubbing, which is good. So I'm gonna palpate your nails for texture, thickness, and firmness. And then assess the capillary refill. Press down the nail beds for 5 seconds. Then let go in the color. We should immediately go back within 2 to 3 seconds. Which is good. Hand height. Okay. Okay, thank you for cooperating with me for the assessment. So I'm going to lower the bed to the lowest position, side rails up, have the collar within reach, and then perform hand hygiene.